Welcome to our guide on securing rural healthcare staffing contracts. In today's video, we'll cover the best strategies to help you land staffing contracts in rural healthcare settings. Getting healthcare professionals to work in rural areas can be a real challenge. That's what we're going to be talking about today, how to navigate the world of rural healthcare staffing contracts. Whether you're a staffing agency, a healthcare professional, or just someone who's really interested in this stuff, this video is for you. We'll talk about understanding the unique challenges of rural healthcare, building relationships with local providers, offering competitive compensation packages, and more. So, buckle up and let's get started. So, why is rural healthcare staffing so important? Folks in rural communities deserve access to the same quality of healthcare as anyone else. Rural healthcare facilities often face unique challenges: geographic isolation, limited access to resources, and smaller patient populations. These challenges can make it harder to recruit and retain skilled healthcare workers. By connecting healthcare professionals with rural facilities, we can help bridge the gap in care and ensure that everyone has access to the healthcare they need. When rural healthcare thrives, everyone benefits. Before we jump into the strategies, let's understand the lay of the land. Rural areas often face significant hurdles in healthcare. One of the biggest challenges is physician shortages. According to the National Rural Health Association, there are only about 39.8 physicians per 100,000 people in rural areas, compared to 53.3 in urban areas. Then there's the issue of lower salaries. Healthcare professionals in rural areas often earn less than their counterparts in urban settings, making it harder to attract top talent. Rural hospitals and clinics often have limited access to specialists, advanced equipment, and even basic supplies. Alright, so how do we tackle these challenges? The first strategy is all about relationships. Building strong, genuine connections with local healthcare providers is crucial. People want to work with people they know, like, and trust, attend healthcare conferences, visit local hospitals and clinics, and engage in online networking. Take the time to really listen to the needs and concerns of healthcare providers. Be a resource, be a partner, and build those relationships for the long haul. Let's talk money. Compensation is a major factor for healthcare professionals when considering a job. In rural areas, you need to sweeten the deal. Offering competitive salaries is a must, but don't stop there. Think about other perks and benefits that might be particularly appealing to someone considering a move to a rural community. Relocation assistance is a big one. Housing stipends are another great option, especially in areas where affordable housing is scarce. And don't underestimate the power of bonuses. In today's digital age, you've got to meet healthcare professionals where they are, online. Leveraging technology is essential for effective rural healthcare recruitment. Online job boards like Indeed, LinkedIn, and Healthy Careers are great places to start. Social media is another powerful tool. Create profiles for your agency on platforms like Facebook, Twitter, and LinkedIn. Use them to share job postings, industry news, and engage with potential candidates. Specialized staffing software can help streamline your recruitment process. Every rural community is unique with its own specific healthcare needs and challenges. Before you start recruiting, it's important to do your homework and understand the lay of the land. Familiarize yourself with licensing requirements, credentialing processes, and any other relevant laws or regulations. The more you understand the local context, the better equipped you'll be to develop effective staffing solutions. You've recruited some amazing healthcare professionals to work in a rural community. Now it's time for the equally important part, keeping them there. Retention is key in rural healthcare staffing, and ongoing training and support are essential. Provide your staff with opportunities for continuing education and professional development. Access to resources is also crucial. Make sure your staff have the tools, information, and support they need to feel confident and competent in their roles. Regular communication and support can go a long way in making staff feel valued and appreciated. It's easy to get caught up in the excitement of filling vacancies, but remember, it's not just about getting people in the door, it's about keeping them there. Retention, retention, retention. Make sure your contract terms are clear, concise, and easy to understand. Provide regular check-ins with your staff to see how they're doing, address any concerns, and offer support. Be responsive to their needs. A happy staff is a productive staff, and word of mouth can be incredibly powerful in the close-knit world of rural healthcare. Some roles are just harder to fill than others. For these tough-to-fill roles, you might need to pull out all the stops. Think higher pay rates, hefty bonuses, or even creative incentives like student loan repayment assistance. Referral programs can also be very effective. Offer bonuses to your current staff for referring qualified candidates for those hard-to-fill positions. Think outside the box and consider what unique perks or benefits might be particularly appealing to the specific type of professional you're trying to recruit. In the world of rural healthcare staffing, reputation is everything. Word travels fast, and a good reputation can make all the difference. Provide exceptional service to both your healthcare professionals and your client facilities. Be responsive, be reliable, and always go the extra mile. Ask your satisfied clients if they'd be willing to share their positive experiences through testimonials or case studies. These real-life success stories can be incredibly persuasive for potential clients. Attend industry events, connect with other professionals, and become a trusted voice in the rural healthcare community. You've got your strategies in place, you've built a great team, and you're ready to start landing those contracts. But how do you approach healthcare facilities? First and foremost, do your research. Before you even think about reaching out, take the time to learn as much as you can about the facility, their needs, and their challenges. Tailor your approach to each specific facility. Highlight your agency's strengths and how they align with the facility's specific needs. The goal is not just to pitch your services, but to engage in a genuine conversation about how you can help them solve their staffing challenges. Before we wrap things up, let's talk about the legal stuff. Legal considerations are an essential part of rural healthcare staffing. Make sure all your contracts are legally sound and compliant with both federal and state regulations. This includes things like employment eligibility verification, wage and hour laws, and anti-discrimination laws. Ensure that all healthcare professionals you place have the appropriate licenses and credentials to practice in the state where they'll be working. Make sure you have adequate insurance coverage to protect your agency and your staff in case something goes wrong. Time for a real-world example. Let's say you're a staffing agency specializing in placing nurses in rural areas. You've been in contact with a small, struggling hospital in a remote part of Montana. They're desperate for experienced ER nurses, but they're having trouble attracting qualified candidates due to their location and limited budget. You offer a competitive compensation package that includes relocation assistance, a housing stipend, and a generous sign-on bonus. You also emphasize the unique challenges and rewards of working in a small, close-knit community. The result? You're able to successfully place 2 experienced ER nurses at the hospital, filling a critical staffing need and ensuring that the hospital can continue to provide quality care to its community. Securing rural healthcare staffing contracts requires a strategic approach, a deep understanding of the unique challenges involved, and a genuine commitment to serving both healthcare professionals and rural communities. Building strong relationships is paramount. Offer competitive compensation packages that go beyond just salary. Leverage online job boards, social media, and staffing software to reach a wider pool of potential candidates. Let's keep working to make sure that healthcare is a right, not a privilege, for everyone. And there you have it, a crash course in mastering rural healthcare staffing contracts. It's a challenging field, but it's also incredibly rewarding. By connecting skilled healthcare professionals with rural communities in need, you're making a real difference in the lives of countless people. So go forth, be strategic, be persistent, and never stop advocating for better healthcare access for all. Thanks for sticking with me through this deep dive into the world of rural healthcare staffing. If you found this video helpful, give it a thumbs up, subscribe to the channel for more awesome content, and share this video with anyone who might find it useful. So, that's the deal with rural healthcare staffing contracts. It's tough, but it's so important. We need people willing to take on the challenge of ensuring that everyone has access to quality healthcare no matter where they live. And if you're one of those people, if you're out there working in rural healthcare or supporting those who do, thank you. Let's keep working to make sure that healthcare is a right, not a privilege, for everyone.